Our guest today is a family nurse practitioner that specializes in aesthetics and optimal healing. Please help me to introduce Aesthetic Injector Bertha.
Hi, Jonathan. How are you?
Good, good. How are you?
I'm good.
I'm so glad that you were able to do this today.
Thank you. Thank you.
Awesome. Hey Bertha, so how have you been? How's everything been since COVID-19?
Oh, since?
I know, still going.
We're still in COVID-19
Yeah.
right now. The never ending.
Yeah.
It's been very challenging.
Yeah.
I think it's been challenging for everyone.
For sure.
I feel like the last 2 years, 2020 as well as 2021, have been like a blurb.
Yeah.
You know, but we're still here, we're still going, so thank God for that.
Yeah, and I say the same thing. Like, I've talked to a lot of providers, they say it has increased sales since then. So I'm like, wow, it's interesting that this industry is booming even through such a hard time.
I think it has to do a lot with people being at home, the era of Zoom or online communication, virtual communication, where people are seeing their face 8 hours a day,
Yeah.
you know, and they're noticing little imperfections or all the imperfections, because that's what we do best as humans, right? We notice our imperfections. So once they're seeing that, now they're just more, you know, inept to like, I gotta go fix this, fix that. Oh my goodness, look at this, the spots on my face. It's because they're looking at themselves 8 hours a day.
Yeah. I can agree with that. Yeah, definitely.
The other side of that is also they have the time to actually do it. I know I was talking to some plastic surgeons, and obviously, you know, they were like, man, it's booming, you know, just like you say. And their take on it was that they have the time to take off 2 weeks, 3 weeks, 4 weeks that it would take for them to recover. Whereas when they were working, you know, so that's also the other factor to it. And then this pandemic money. I mean, I'm just saying, you know, the pandemic money obviously got everyone doing something.
Yeah, like I hear people who are like using like care credit and things of that nature, really just get everything done. So. Or
they're illegally using SBA funds. Or I'm just saying, you know, but yeah.
Amazing. So tell everybody, what do you have me hooked up to today?
So you asked me for something for energy.
Yes.
Right? So when we talk about energy, first of all, we definitely want to hydrate yourselves, because as we know, we are made up of 80% water, you know, and so a lot of us are walking around dehydrated. So just the immediate hydration from the fluids is going to give you that energy, because your cells are not like crumpled up or anything. Now they're like, oh, we got fluids coming. Awesome. So that's normal saline fluid, which is going to help with that. And then I put in a combination of B12, which boosts energy. As we all know, it's also good for cognitive function.
Nice. And
also MIC, which is, the MIC with the B12 is what we call the skinny shot, but it really gives you a boost of energy. So MIC is these vital nutrients, methionine, inositol, and choline, which help to actually increase your energy and actually suppress appetite as well.
Wow,
you know,
amazing.
Yeah. And then I gave you a little bit of vitamin C, you know, because vitamin C in normal saline with B12 is a beautiful combination, you know, and it just helps with your skin. It helps with, it's like an antioxidant. So it's going to decrease any type of stress that your body is feeling, you know, free radicals that may be there. So that's going to also help to boost your energy, boost your mood, help you feel better. I also put in there B6 on its own, because B6 by itself just helps with everything. And then I put all of the B vitamins in B complex, and those help with giving you energy as well.
Wow, that's a lot.
So you have the gamut of everything there that you need to have you hydrated. This will last like about a week. You'll definitely feel the immediate effects because it goes directly into your bloodstream.
Amazing, amazing.
Yeah, it's not where you're taking oral medications and then they have to go through your GI tract and maybe you get 50% absorption. This is close to about 90, 97, 95%.
What type of people, I guess, or who would be the ideal person that would be great for this type of thing?
Anybody. You have your pro athletes that take it for recovery. You have people that have medical conditions like diabetes, or they're overweight, or they may have mental decline, neurological disorders, autoimmune diseases. IVs can be specially formulated for them because they have different cocktails, different nutrients, vitamins, supplements, medications that can go into it to treat exactly what we want it to be treated. Those that are dehydrated, or the ones that get a hangover. Yeah. And they don't want a hangover. They want to prevent it. They've had a fun night. Then they usually book parties to go ahead and hydrate themselves, get the nutrients that they need, and they feel good as new.
Wow.
Yeah.
Great. And when I go to Vegas or anything, I'm coming back here.
Right.
For sure. So I wanted to start from the beginning. How did you get started in the aesthetic and optimal healing industry, actually?
All right, so let's see. I never really liked aesthetics, to tell you the truth. No, I'm gonna be honest. When I graduated as a nurse practitioner about 5.5 years ago, I always knew that I wanted to get into functional medicine, holistic medicine. That was my path. That was my dream. I didn't want to practice conventional medicine, and I was lucky enough to find an office, where I learned about this, and this information blew my mind. I was like, oh yes, this is exactly where I need to be. Someone had mentioned it to me, and I think that's where you belong. I'm like, okay, well, let me look up what functional medicine is, because I had never heard of it. When I looked it up, it was basically a simple definition of it is getting to the root cause of the disease, as opposed to treating the symptoms, and really providing a holistic approach to caring for that person, because you're not just your pancreas or your heart or your brain or your kidneys or your liver. Everything put together is what makes you. And so when one thing is not at optimal, then it affects everything else. Instead of looking at it at parts, I like to explain it to people like a car. I feel like we take better care of our car than we do our bodies. We take our car to the mechanic. The mechanic doesn't just look at the brakes. He does a whole entire, diagnostics on it and comes back with a report. Sometimes we don't like the report, but okay, your tires are this, your brakes are this, your engine this, you need oil, you need this. And he takes care of everything. He doesn't then send the car to, you got to take the car to this person for the brakes, and you got to take it to this person for the oil, and you got to take it to this person for that and that. No, he looks at everything and takes care of everything, because if your tires are not good, it's going to affect your drive. If you don't have enough oil in there, it's going to affect other things. Our bodies are the same way, but we don't care for it that way. We have all of these specialties and nobody talks to each other.
So how did you, tell me a little bit about how you kind of put that process together in this industry?
So I like to say aesthetics chose me, because like I said, I did not like aesthetics. For me, you anti-age from the inside out. Yeah. I could anti-age you with peptides, with, hormone replacement therapy. I can get you right. But aesthetics is married to it. They come together. They really do. Because when you dress up and you put on your makeup, or you do your hair, or you put on something nice, you feel good. It's part of your mental health. It's part of your mental well-being. If you have marks on your skin or things that you don't like about the way that you look, and you take care of that and you do it, you glow. You glow differently when you do these things. And so for me, that's why I love the fact that I do both. Yeah. Because not only am I taking care of the inside, but I'm also taking care of the outside. There's acne that you want to get rid of. Okay, we definitely have to do things on the inside, but there are things we can do on the outside as well. You don't like that wrinkle. You don't like the way that your under eyes are. You want you know, bigger lips, or you want your lips to look more hydrated. Any of these factors are going to make a person feel better. So that's what I started to notice, that they're married to each other. And a lot of people would come about things to improve on their outward appearance. And then I started talking about the inward appearance, but they're definitely together. And that's how, you know, aesthetics came to me. And I was a little bit naive, I will say, when it comes to aesthetics, because this is a serious medical specialty. I mean, it goes deep.
Yeah.
You know, you start talking about lasers, and you start talking about, you know, anti-aging, things that they can do. I mean, this industry, this is definitely a medical specialty, and it requires some serious skills. And so I fell in love with that, with the challenge of it, with like, wow, this is really, really interesting, and the things that you can do for a person, especially with me being, you know, a Black woman. I was like, oh no, this is my niche. Like, I take care of people of color.
That's a really good point. I love everything that you just said, for multiple reasons. You know, definitely because it is a marriage, right? Aesthetics is not, it's a lot of variations of it. It's very deep in it. And a lot of people think it's easy to get into. It's quick. You can learn a lot in just a weekend and be done. No, it takes a lot of work and effort to get into it and learn a lot about it.
I think any skilled injector doesn't ever say that they've arrived, you know, because there's always learning. There's always improvements to your technique. There's always something new that just came out, some evidence-based practice. So you always have to maintain that continuing education so that you can be the best, which is why I don't really like the word master injector. It's just my pet peeve, you know. Just feel like you're a skilled and educated injector, and you're going to do what you have specifically been trained for, and you're going to continually train yourself to improve on getting better at your technique and getting more skillful.
Wow, wow, couldn't have said it better. How did you get started in the industry? Like, how did you land your first position?
So, like I said, I was lucky enough to go into functional medicine. About a year after being there was when I landed a position as a nurse practitioner in Boca. Nice. It was a private practice, and I was the sole nurse practitioner. And not only did they practice functional medicine, but they practiced aesthetics, injecting. So that was how I got introduced into Botox, into fillers, into IV therapy, into hormone replacement therapy, peptides, lasers, you know, and so that's how that happened. I was there for like almost 2.5, 3 years, you know, and then I was like, okay, you know, it might be time to start thinking about when I'm going to transition into doing things on my own. So that's kind of how it happened, you know, and when I decided to transition, like I said, aesthetics chose me. You know, it's like, oh, this is a part of it too. So that's when I started to invest in myself. Nice. Invest in trainings, invest in workshops, invest in just making sure that I was skilled in that. And through that process, I began to really fall in love with it.
Wow, investment is a big key there.
Yeah, the ROI on that is priceless.
I can definitely understand that. Now, being a sole nurse practitioner in your clinic when you first started, I know that might be scary. How did you know, like, hey, I can take this on not knowing the industry?
So I've had a motto from when I was little. I don't know when I developed this motto, but I can't remember what age. And my motto is, if someone else has done it before me, then it means that I can do it. And if no one else has done it before, then it means that I'll be the first. And I've just always been that type of person that has been extremely determined. And when I put my mind to something, it always gets done. So although I was fearful, scared as who knows what, I still went in there. And funny story, the way that I really got into it on my own was when I purchased my laser machine. because I was doing concierge in home. So my overhead was very low. I didn't have a location, 2 days out the week out of this little suite that I was renting was really nothing, but when I purchased this laser, yeah, it got real. It got really, really real, because this laser was $125,000 and my monthly on it would be $2,600 plus. And I was like, okay, things just got very real for me. And it was actually delivered to my house because I didn't even have a location.
Wow.
That's how much I stepped into it. Like, it got delivered to my house with me not having a location. And then I was like, okay, it's time to find a location. Like, right now, it's time to get things ready. And that's how and I did that for a reason, because then you would light the fire under my ass. If you purchase this, that's it. There is no going back.
Yeah.
So that was how I did that leap. But believe you me, there was a lot of anxiety.
Yeah.
There still is.
I just left M-Spa, and they were warning everybody about the lasers and laser reps and how they'll sell you everything, and just gotta be careful if you can afford it or not at the time.
Absolutely,
and things like that.
yeah. You have to look at everything.
Amazing.
Look at everything, and that's, for me, that's very important, was the post-sales support from the company that I went with.
Nice.
Yeah.
How big? I know you're big on faith. How big did faith play a role in kind of you jumping on your own?
Very big, very, very big. So my belief in God is very special to me, like my relationship with God, and so it's that hope, that faith, that knowing that you didn't bring me this far and you're gonna leave me. When I can't rely on a human being or, someone that is faulty, I know that I can always rely on God, because he's gotten me through all of this. And I think that hope, like, really, you can go through the fear, it's just gotta get out the boat and just walk on the water.
Yeah.
You just gotta do it. And so really, really big. It definitely is a main factor. And I'm very spiritual. I speak to my patients about it, and because it's a big part of the healing that I think is missing in a lot of places. Yeah. We talk about that, and just being an overall good person. And what does that mean?
Yeah, I mean, I could agree with that. They have did studies and said, like, mindset is the number one thing. So having something that you believe in, having a religion that you believe in, that you have full faith in, I think can help the healing process.
And having a community of supporters as well, because it comes with that. So that also helps with it. So yeah.
Nice, amazing. So tell us about your office, your clinic. Tell us which services you offer. Who would be your ideal customer? Tell us a little bit about it.
So my practice, I do not call it a med spa, because it's way more than a med spa. It's a functional medicine and aesthetics practice. Awesome. And on the functional medicine side, the ideal client is someone who's pretty much tired of the traditional way or the conventional way of practicing medicine. They don't want to be on medications, or they don't want, okay, so I'm on this medication for my blood pressure, but now I need to take this medication because this side effect happened and this side effect happened. And they're still feeling crummy. Yeah. I'm just like, well, what am I taking these medications for if I'm still feeling crummy? If I still don't feel good, it's because you're not at your optimal self. So pretty much it's those that want to get off of their prescription medications, or those who have maybe been diagnosed with new diabetes, a newly diabetic patient, or someone with high blood pressure, and they don't want to start the medications. What's a holistic or alternative way that I can go ahead and do this? Or someone who just believes in a holistic approach, and so they would be taking their body to the next level. They want to be on great supplements or peptides or hormone replacement therapy, so it all depends. So that's the functional medicine side, which is looking at the root cause of the issue and not treating just the symptoms. On the aesthetic side of it, it's, the Botox, the injectables, the Botox, the fillers, the PRP, the lasers, you know, any of those things. And then there's wellness, like IV therapy, teeth whitening. Like, you just want to take your wellness to another level. Peptides, exosomes, you know, just taking it to another level. And so there's root cause medicine, there's aesthetics, and there's wellness.
Nice. That's a lot of stuff to offer.
It's a lot of stuff to offer. Sometimes I can't even remember all the things that I offer. I even have body contouring, which is part of the aesthetics.
Wow.
Obviously.
That's amazing.
Yeah.
Like M-Sculpt and Cool Sculpting.
Exactly, but I don't have that one.
Oh, okay.
I have True Sculpt ID.
Nice.
Yeah.
Do you ever think there's a time to kind of recommend Western medicine, or what kind of your
Absolutely. So I love the word integrative medicine.
Nice.
That's my favorite. Integrative medicine is incorporating that Western medicine in with functional medicine. So there may be somebody that needs to start on a blood pressure medication because their blood pressure is very unstable. But while we're putting them on that medication, we're working on the root cause of it. Is it a magnesium deficiency? Is it because you're overweight? Is it to do with your stress? Is it, you know, and we're working on all of these things, but at least we have that medication there to make sure that they don't get any worse. Gotcha. So absolutely, there's times when I prescribe medications. Absolutely need to. I have nothing against it. My problem is when that's the first and only resort, and we're not looking at, once again, the whole person and the whole picture.
Nice. Now, I wanted to ask that question because when I was doing my research on you, and it was so interesting, I found this. You were able to lose 100 pounds.
160.
160?
Yes.
Wow. Unbelievable. Can you tell everybody how you did that? What was the process?
Ooh, let me tell you, that was a process. It really took 9 years, honestly.
Yeah.
I don't really tell people that, but it took 9 years. When I got serious about it, it took a year.
Wow.
But from my heaviest, which was 298, to when I ended up at around like 140, 135, wow. That was a 9-year period. But it was mindset. That's what it was. It was, I'm really sick and tired of this. I'm tired of the yo-yoing. I'm tired of the up and down. I'm tired of the, you know, like I drew a line in the sand and I was just like, this is it. This is how I'm going to do it. And I started out with a juice fast that my friend was having. And I did it for 8 days. I think 5 days, and I lost 8 pounds. And then after that, I was like, hey, anybody, I'm gonna do a raw vegan group. Who wants to join me? I think 9 people said yes, and I started a group on Facebook. And believe it or not, because I started that group, I felt very accountable. And so I never cheated. And every single month, there was a new challenge, to the point where I had them choosing, like, okay, it's your turn to choose what the challenge is. And my body never, ever got used to what we were doing. And so I just kept losing my metabolism system, kept going. We did raw vegan challenges. We did juice fast. We did no sweets, no breads, no this, no that. I mean, we had so many different challenges. We added exercise into it. And it was real simple. Just show what you ate for the day and show your exercise, you know. But I didn't focus on exercising until I got my nutrition down pat. You know, and that made it very feasible and manageable for me. And it was fun. And this was while I was in school getting my master's. So while everyone else was going in the opposite direction because of stress, I was not. And meal prepping, the accountability, my mindset, all of those things played a huge factor. It was me on my own optimal journey. That's what it was.
Yeah.
You know, I was working on everything, making sure that I get to a healthy state.
Once you lost all, which is amazing, congratulations, that's really great. Once you lost all the weight, like, what changed for you on the other side? Like, tell us a little bit about that. How did your life change?
Well, it took a while for my brain to realize that I had lost weight. Because I knew when I went, I didn't know how to shop for myself. I was always used to just going to the plus size section, you know, and that's it. They always kept a little section for us somewhere. But when I lost weight, I would go into the store and my mind wants to go to the plus size section. It's like, no, you gotta, but But then the other section, it's a whole, I mean, it's very different. It's not just a small little section. Now you got like all these different designers or all these different, you know, it's a whole lot more options and variety now. So shopping, I actually had to get a stylist to help me learn to shop for myself.
Whoa.
Yeah, because I didn't know how to shop for the new body that I had. People had watched my journey because I put it, you know, on social media. I was very transparent about it. And so I didn't realize how many people it impacted, you know, and how many people were watching me. And so that, I don't know, I guess it gave me a sense of pride, you know, like, wow, that's pretty cool that, and they wanted to now get on the journey, and because of me, they wanted a healthier lifestyle, and what are some tips, what are this? My group did grow from 9 to, you know, much more than that. Yeah. Not a lot, but definitely more, where people were now like, no, I want to be part of the next challenge, whatever it is. And that changed, and then, you know, people look at you differently, which sucks. That part of it sucks. But I was a different person. I have to say that, but I was a different person, you know. I didn't look the same as I did before. And so that, you know, that changed. More stairs or more this or more that. There was a point where I think I lost a little bit too much. Not I think, but I did. And so I got ridiculed, or I got called this or that, or so there was all of that factor in it. It's like, wow, well, you guys just don't know how to leave people alone. If I'm this way, I'm this. If I'm this way, I'm this. You know, but finally, I was able to find a happy medium, like a happy place for myself. But it definitely, I had to have therapy for sure, you know, to help me through that process and help me through that transition.
Do you still talk to anybody in the group, or still like help encourage?
Yeah, absolutely. A lot of them are still, a lot of them have actually become my patients.
Amazing.
Yeah, a lot of them have actually become my patients, you know. I used to be a plus size model. And so a lot of those in that industry, you know, some have become my patients. I'm still friends with them. Yeah.
Wow, that's amazing. What? How long did you do that for?
9 years.
Wow, wow. What did you learn from that?
A lot. A lot, because I actually was the face of one of the companies that I won a contest from. And from there, I learned how to put on production shows. Like, I would put on whole entire production fashion shows. We traveled around the United States putting on these shows. So I learned a lot.
So you won a contest to get your contract?
I won a contest it was a fashion show.
Nice.
And in winning that contest, I won the cover of like a magazine and to be the face of the company. And then I kind of just grew into almost being, like, basically being a partner with the owner. Oh. Because I loved it so much. And like I said, whatever I do, I'm going to put my all into it. And so I believed in the message. You know, the company was called One Chance Entertainment. And it was like, you know, everyone deserves that one chance, no matter the size or whatever. And I know that the fashion shows, the makeup, the clothes and all of that gave me a boost of confidence when I was doing it, and so I knew how it helps people with their image.
Wow, wow. See, finding fact. I didn't even know that. Freehand, that's amazing.
Yeah.
Now, I see, like, you told me you were pregnant. Congratulations.
Thank
on
you.
That. How has that been with working? And tell us a little bit about that.
Listen, this has been a challenge. So, my first son, my first child, he's 20 years old. This is my second baby. So that's 20 years apart. And this is totally different because I was 18 years old. You know, when I was pregnant with him, I was still in high school. I really didn't feel anything. This pregnancy here took me out. Mm-hmm. It took me out so bad it actually affected my business. Mm-hmm. Oh, it definitely did. I could not, there were so many days I could not work. I'm still going through that right now, you know. Yeah, I actually ended up with prenatal depression. And what I realized was that there really wasn't any resources for pregnant women. There wasn't anything out there for us, especially from like a holistic standpoint. And so, I don't know, it left a little bug in me or something, like maybe I should do something with this after, you know, I've dealt with my stuff. But yeah, it's just, business has been very difficult for me because of the pregnancy, but we're almost at the end.
Amazing.
I'm trucking through.
Amazing. Is there any resources that you would like to give, or?
So let me think, because like I said, when I say extremely limited, even when I spoke to my midwife, she was like that there's really not much out there for her, even when she's trying to refer her patients out. And I think it has a lot to do with liability of, you know, when a woman is pregnant, many people don't want to touch that. Also, just the ethics when it comes to maybe doing research on a pregnant woman. That's another, you know, taboo area. So there really wasn't much, but I think what I had recently just found, there is a place here in South Florida called The Gathering Place, and so they do support groups, and they're trimester specific, first trimester, second trimester, third trimester. It's free, you know, and I find that being in support groups with other women that are going through what you're going through, it helps, you know, with the process. And then also some Facebook groups, you know, and joining different Facebook groups that deal with a little bit of what you're, you know, going through. So this is a little bit personal, but I'm a single mom by choice, you know, and so when I decided to go on this journey of motherhood, this was completely planned, you know, finding a donor, all of this stuff. And so I am part of a group called Mocha SMC on Facebook. And so it's where Black women are able to gather and unapologetically speak about anything, you know, that relates to being a single mother by choice, because that's the other challenging part of my pregnancy as well. Beautiful part of it actually is that I'm going into this as a solo parent 100%, and I love all aspects, you know, of that, but having that support of other single mothers by choice that are also, you know, women of color, you know, helps. So Facebook groups, that resource that I told you about, The Gathering Place, and then just friends, my mother, my friends, my close family, you know, those that help me out, cooking for me or just being there for me or giving me a word of encouragement. That has also been very helpful for me, is find your tribe.
Amazing.
Have a tribe.
Yeah. Yeah, no, that's a big key that you just said. I know you mentioned that multiple times during this interview, is community. Having that community seems to help to grow so much more.
Absolutely.
And, you know, I think that's a big point.
You go further with other people instead of by yourself.
Mm-hmm. Mm-hmm.
That's how I grow in the aesthetics industry. It's with people, you know, not by myself.
Do you think it's a strong community in the South Florida area? Or have you seen that getting in the industry?
You touching a very touchy subject right there. So I'll tell you what I have noticed, and is something that behind the scenes I definitely want to put some more thought and work into it. Like I said, when I get through this pregnancy, is in the aesthetics industry there seems to be a lot of like groups, cliques, you know. What I don't see is representation of me, with my lasers, with my skin pen, with anything that I'm getting, Botox, fillers, whatever company I'm going with. They don't have representation of Black women or women of color. I actually had to get my laser company to make special marketing materials for me, because everything they sent me was a picture perfect white woman. That's not my audience. You know, you're missing $1 billion audience right now because you're not showcasing women of color. And I find that a lot, and it's extremely frustrating. When they talk about these big time conferences, all I see is white women. You know, I got on you about this. I went on your page when you came to me, and the first thing I said, Well, what I really don't see is you interviewing Black women, you know, Black injectors or Black providers, because they do exist. And it's just a big, you know, because representation matters. People want to come to someone that looks like them. A lot of people that come to me are new. They're brand new. They've never gotten injected. And they're like, I don't want to go to anybody else but someone that looks like me. And when I saw that you did it, I was like, oh, okay. You know, I trust you because you're my complexion. You come from me. Mm-hmm. And we are a little bit different. You know, there's a saying that goes a decade per syringe, or, you know, that may not necessarily be with Black people. We may not be a decade a syringe. We age a little bit differently, you know. So I don't see that representation at conferences. I barely see Black people on the stages headlining or that. And so that is something that I'm like, no, that needs to definitely change because we're here. Mm-hmm. You know?
Why do you think that is?
I'm not sure. Mm-hmm. You know, I haven't really done like a root cause analysis on it to really see. I mean, I can only make an opinion and say that it's because we're just, maybe we got into it a little bit after, you know, not as soon as. And also a lot of these things were tailored to white women. Like lasers just began to be like, it's safe for all skin types, that type of a language, right? When before wasn't.
Yeah.
There's still some lasers right now that you cannot be used on skin types 4, 5, and 6, which are your darker complexion. And so that where the industry is not yet there to care for our skin. Maybe they don't see that there's a need for it. Maybe, you know, they're just breaking into it. So I think all of these things may play a factor into that. And so
I can definitely understand. What is your favorite aesthetic procedure right now?
My favorite,
or like, what are
you
like using right now?
Okay.
What's your trend?
I love anything that deals with platelet-rich plasma, PRP or PRF. PRF.
Yeah.
And that is because, once again, it's natural. So, you know, you get the functional side of it, right? It's using your own blood, and you get all of those wonderful properties of the platelet-rich plasma inside of there, the growth factors that come with it. And you can utilize that for anything. So I love, like, my specialty is growing hair, you know? So I do PRP or PRF to go ahead and restore and grow hair. I love doing that. It's a slow process. It takes a while, but at the end, the joy that's on my patient's face when their hairline is coming back and their hair has grown, that's wonderful. PRP or PRF for under eye fillers, or for microneedling, and you put the PRP all on the face for that, you know, anti-aging effect and tightness to it. It's, for me, anything that deals with PRP. PRP for the joints.
Yeah.
You know, for your muscle pain or for joint pain, and how I prevented several people from actually having surgery because of utilizing PRP or PRF on particular joints and different factors like that. So for me, it's anything that utilizes PRP. I love it. Yeah.
So who would be a good candidate for PRF?
So candidates for PRF or PRP would be like your athletes that want to recover quicker. It's what basketball players, football players do to get back on the courts quicker. If you have knee pain, joint pain, muscle pain, any of those things, that would definitely help. And then you have those that want it for like anti-aging, right? So if you're doing microneedling on the face and you put some PRP on there, it's going to tighten it. It's going to give it a nice natural look. They're not quite ready to jump into Botox or fillers, but that can also help. And then for vaginal rejuvenation as well, you know, we've all heard of the O shot or the P shot, you know, so it can help with you know, helping in that area sexually. As well as medically, you know, with urinary incontinence. There's so many properties to PRP and PRF. It's natural, so it, you know, falls in line with the whole organic, natural. There's no chance of it rejecting because it's your own blood. And I have ways of making your PRP much more potent and stronger. Pretty much it.
That's what I was gonna ask. Like, do you have to eat healthy and clean, and your blood has to be clean in order?
So what I tell them is, at least for 3 days, a week would be even better. I want you to go on a plant-based diet, you know, because that's gonna give your blood so much more nutrients and vitality, and it's gonna be good quality blood, you know, for the PRP and the PRF.
Wow, amazing.
No alcohol, you know, like you don't want it to take anything in that's gonna affect it.
Wow, that's great. That's truly great, actually. So tell us, do you have any training conferences or anything like that that you would recommend, even any publications that new injectors or maybe experienced injectors can follow?
Sure. So let's see. So for me, I go through functional medicine as well as aesthetics. So on the functional medicine side, I love A4M. You know, it's a great conference. They still include a lot of aesthetics because, like I said, it's a marriage. I love that conference. Some of the things that I've heard, I've been blown away by it. So I like to go to that conference, and they have throughout the year. And then there's certain supplement companies like Zymogen, Orthomolecular, that they'll also do different workshops, you know, showcasing how to utilize their medical grade supplements and how they can help. So I also, you know, follow different supplements that I know have very strong, how do I say, their vitamins and supplements are like the highest standard, even higher than what USP would say to do. And then for aesthetics, so I have Cutera devices. And one of the reasons why I went with Cutera is because of their post-sale support. I have 2 devices. I have the TrueSculpt ID and I have the Zeo. So every year they do something called CUCF, which is a clinical university clinical forum where they invite the best of the best to be, you know, panelists. And so it's basically learning from other people that have done different procedures. We go through case trials, clinical trials. And so I go to that every single year. So whatever, if you're gonna buy a laser or something, just look at the post-sale support and what they provide for you. Because after you have this laser, you need that extra support, you know, and they have amazing post-sale support. So I try to go to Cutera events as well. I also, let's see which other one I have gone to. I can't remember off the top of my head. I haven't been to an AM spa. You know, I go to multiple trainings, but a lot of the trainings that I do, I'm very specific to where I go because I like the one-on-one experience. I don't like to go to big classes.
Yeah.
I like to go to a very experienced trained injector that's going to show me something and give me that one-on-one experience that I like. So I do a lot of those throughout the year as well.
Amazing. Wow. And I'm going to drop all of those below so you can go ahead and follow and check those out. Is there any people on Instagram, such as doctors or injectors, that you would like throw out there that might be good to follow, might learn something from?
So Dr. Mark Hyman, he's very big when it comes to functional medicine. He is, I believe, the director of clinical, is it Cleveland Clinic? Oh. You know, he heads the functional medicine side of that. Tracy Harrison, that's where I went for a lot of my education. She is the owner and lead teacher, educator for SAFM, which is School of Applied Functional Medicine. So I follow a lot of their things. You have the Kessler, you know, Institute. So a lot of those that are considered like the founders of functional medicine, or who really, you know, got in the game, I definitely would say follow them for functional medicine. And then for aesthetics, so let's see, I think Aero Institute, she's one of the very few Black injectors that also teaches. So I would actually recommend her if you're looking for going into, you know, wanting to take classes and things like that. Ebony, that's actually located in Boca Raton, she's an instructor for that institute, you know. So Ebony is a close friend of mine and we talk a lot. So a lot of people for me are people that are regular, like Loretta Zanetti. She's in Tampa. She was a nurse practitioner that I met at my first Cutera conference. And I was like, she was the only nurse practitioner that was up there, you know, as part of their expert team. And I talked to her and saw where she started and where she is now. I'm like, wow, you know, she's a big supporter and big someone that I look for guidance and training from. Yeah. And then there's Sonia Lewis with the Lab Med Spa located in South Lake, Texas. And I love her because she loves to give back. And she's with me when we talk about, like, yeah, that whole decade per syringe doesn't go for Black people, or we need to figure out who is the person that's the headliner, because, yeah, it's not represented. And she just really wants to prepare whoever's behind her coming up. She's very giving, you know, so she does classes as well. Excellent instructor. And her med spa in Texas, and I would say it's way more than a med spa because she does functional medicine as well. She's getting into that and expanding her practice to that. So more and more people are also marrying the two because they see it, you know, it goes together. Those are some of the names that I can throw out. Beauty Bay, I took classes with her, you know. She's so humble, she's sweet. So like I said, I like those intimate classes, one-on-ones. I'm not very big on 30, 40 people in a classroom and you get like one little practice session. That doesn't do anything for you.
Yes, no, I can definitely agree. Definitely agree. Well, thank you so much, Bertha, for sitting down with me and speaking more about the aesthetic industry and optimal healing. I learned so much. I'm sure the viewers learned a lot too.
I hope so.
Tell everybody what you have, where they can find you and what you have planned next.
So, finding me. So, Optimal Healing, the number 4, the letter U.com. That would be the website, but that would also be on my social media handles. Instagram, Facebook, Twitter, YouTube. They're all, they're TikTok, you know, you can find me through there. So that's how you can find me, and all my information really you can get from my website, all of the social media from my website. So Optimal Healing, the number 4, the letter U.com. And as far as what I have planned, being a mommy, you know, she's due in April. You know, the second week in April, and I'm going to be taking some time off to really devote to her. And then after that, like, so I do have classes that I do. So I was a teacher. Sorry, I was a teacher before I went into this. So you know, I've always taught nursing students. I taught RNs. You know, I did all of that. And so the love of teaching has always been with me, and I like believe in giving back. So I do classes as well. A lot of my classes are online. So I have IV hydration classes, PRP classes, basic Botox, basic fillers, things that are online that people, you know, can take. And if you follow me, you'll notice whenever I have any class or anything coming up. So a lot of more things virtual until I get back into the office and that. So that, you know, it's basically classes, virtual classes, speaking engagements, things like that.
Amazing, amazing. I'm going to drop all that below so you can go ahead and check that out. I know those classes do work and they're amazing, especially if you're a beginner or even if you're experienced, you want to just touch up on things.
Absolutely.
But until next time, goodbye.